Today, we're having a conversation with Dr. Latika Chawla. She's a gynec, OB, and a laparoscopic surgeon. We're going to be speaking about a very, very interesting topic today called endometriosis and the laparoscopic surgery aspect of it. Dr. Latika is going to be helping us with some very important insights about this topic, which is now very rampant, and so many girls face this on a day to day basis. So, Dr. Latika, thank you for being a part of the conversation today.
My pleasure, Karishma. Thank you for having me.
I want to ask you the first question. What exactly is endometriosis? And, can you please explain who exactly is at risk for this?
Right. So endometriosis actually is a condition where the normal lining that is present inside the uterus. So we have like a uterus, two tubes and two ovaries, okay, and a small lining inside the uterus that keeps building with each cycle and then shedding off in the form of your periods. So this lining that's present inside the uterus has endometrial cells in that. Similar kinds of cells known as endometriosis cells, so they are similar but not the same, are sometimes found outside of the uterus. So they can be in multiple different places. I've actually made a diagram that I can show you easily. So if we were to look at it this way, okay, so this is how it normally looks like. You have one uterus, you have two tubes, you have two ovaries. This is the mouth of the uterus and this is the vagina. Okay, so if you can see, I've drawn a dotted line here, which is basically the lining inside the uterus. And this kind of a lining is then present in other areas outside the uterus. So around the ovaries, around the tubes, sometimes in the muscle of the uterus as well. It can also be present in certain other areas. This is if we are seeing from the side view. This is the uterus. In front of the uterus is the bladder, where the urine is stored and where urine is passed from. And this is the rectum, which basically is the place from where you pass your motions.
Yes.
And these are very closely close to each other inside the pelvis. So there can be certain of these endometriosis cells present in between these two anteriorly and in between the bowel and the uterus even posteriorly. So these are the different areas where you're going to be able to find these kind of endometriosis cells. And why is it important is because this kind of bleeding that happens inside the lining of the uterus every single month then also goes on with these cells which are present outside the uterus, which then leads to the symptoms that take place with endometriosis. Okay, and you'll be surprised to know that actually 1 in 10 women have endometriosis, but sometimes in the very early stages of endometriosis, there can be no symptoms. Or these mild symptoms that are missed off or brushed off as something else because the awareness about the disease is not much.
Yes, yes.
And as far as the risk part that you asked me, there was a thinking originally that these endometriosis cells develop outside the uterus because some of the period blood goes through the tube to the outside and that's how it deposits these cells. But that is a very old theory. As we are knowing more and more about this disease, we are understanding that it is a lot to do with genetics, in fact. So there is a chance that, if your mother has endometriosis, then you and your sister might end up having endometriosis. So there is a lot of new information coming out there. And the genetic risk is, as of now, proposed to be the most important risk for having endometriosis.
All right. Thank you. Thank you for that insight. I think that's very important to know. And, with the new findings that everyone is finding out, I think the genetic factor finding out is fantastic discovery. Thank you, doctor, for that. Also wanted to know from you, the laparoscopic bit. So how does laparoscopy play a role in, helping out or in a way where, it can play any kind of role in endometriosis?
So, in fact, laparoscopy has a huge role to play in endometriosis as far as diagnosing it is concerned as well as treating it.
Okay.
Initially, if there is an advanced stage endometriosis, a severe disease where a lot of the ovaries and pelvis region is involved, the uterus is swollen, it is easy to pick up those things on an ultrasound examination or even when you do an MRI. But when there is a mild to minimal disease, which is causing symptoms, then it is very difficult to pick up this on an ultrasound. So traditionally, laparoscopy has actually been used as one of the techniques to diagnose early endometriosis, which means you put in a small scope through the belly button to
Yes.
look for these tiny, tiny spots. And I think, as we spoke earlier, laparoscopy magnifies the image 15 to 16 times. So it's easier for us to spot even the slightest, lesions that are present inside the pelvis and pick them up. So, one of the other things that I want to really highlight here is that sometimes we think that the symptoms will be severe if the disease is severe. But endometriosis is tricky that way. Sometimes, where even a mild disease, but if it is at an odd location, like if it is irritating a nerve inside the pelvis, or it is, going into a nerve, can cause very severe pain. So you might not see anything on the ultrasound, you might not see anything on the MRI, but you will still have that lesion, which will not be picked up. So laparoscopy is a very important role in picking up these lesions. So diagnosis definitely, and treatment, in fact, I think gold standard of treatment is laparoscopy now, with evolving technology, with 3D laparoscopy, with robotic technology available, where you're able to see every inch and nook and corner of the pelvis through a very special camera, which even the naked eye will miss in an open surgery. So you can pick up these tiny, tiny lesions and remove all of these in laparoscopy. So it is, in fact, the standard of care. I don't think we do open surgeries for endometriosis anymore.
All right, that's good news. That's fantastic. Doctor, will you explain the stages of this particular disorder? And how is it that, at what stage should women know that, I have to go in for a laparoscopy now when they have this condition? If you could just explain this, please.
Yeah. So endometriosis, like I told you earlier, either could be completely asymptomatic, or it might present as pain. Pain which occurs during periods and goes away after that. Painful periods which are going on increasing, the pain going on increasing. Also, sometimes the pain becomes so severe that it stays off even after the period is gone off. So basically, any sort of lower abdomen pain, pain while passing motions, pain while urinating, this kind of a thing, pain while having intercourse. So those are the things that can suggest towards the fact that there is some endometriosis. Another thing that endometriosis can present as is difficulty to conceive. So very early minimal endometriosis sometimes the women can find it very difficult to conceive, because it can affect both the quantity as well as the quality of the eggs in the ovaries. So like I showed you, if there are deposits like that present on the ovaries, then they can keep bleeding every month and form these cysts or blood filled cysts inside the ovaries, which are called as chocolate cysts, because it's that old kind of blood that is, that's brownish and blackish in color that looks like chocolate. That's why they're named as chocolate cysts. But those are the cysts that remain inside the ovaries and then cause pressure on the ovaries. So whatever eggs are present in the ovary, their quantity also goes down and their quality also gets hampered. So it does have a significant impact on fertility as well. As far as the stages are concerned, traditionally they used to just define it as minimal, mild, moderate, and severe stage, depending upon how much of the disease is there. So if there are just few spots present in the pelvis, not really affecting a lot of the ovary or forming these kinds of cysts, then it's a milder disease. In an advanced disease, what basically happens is, since every month you are going through that regular period, there is bleeding happening everywhere inside the cavity, in front of the uterus, behind the uterus, depending upon where the lesions are. And then they all kind of cause the intestines to clump together, the uterus to get stuck to structures behind and front, something we name as frozen pelvis. So when we look inside, we see everything clumped together. That is the uterus, the tubes, the ovaries, the bowel from behind, the bladder from the front. So that in itself is very, very advanced stage endometriosis.
Thank you for that detailed explanation on the stages of the entire problem. Also, Doctor, you mentioned infertility. So, in connection to infertility, I would also like to know that when, there is a laparoscopic intervention, in treating endometriosis, does that actually help with fertility as well? Is there a better rate of consumption, or sorry, is there a better rate of conception when, there is the intervention of laparoscopy for endometriosis?
So, in fact, mild disease, it has shown that if you take out that mild disease, if there are little lesions and you've done a laparoscopy and taken out every small tiny lesion, like I said, the quality of the eggs does improve. So because of those lesions in the body, sometimes the toxin in that area is so much, something we call as inflammation in medical language, is so much that it is affecting conception. And if you remove those lesions, then it does improve conception. So very early disease, laparoscopy does help. Advanced stages, not necessarily, because already there is so much damage that has happened that natural conception becomes difficult. So depending upon how much damage has happened because of endometriosis, in association with your fertility consultant, we take a call on a very individual, customized basis whether the patient does or does not need laparoscopy prior to fertility treatment. Because endometriosis is a disease that keeps growing with each cycle that you have. If you know that you have endometriosis and you know you want to get pregnant, then the faster the better. So the first primary aim is to really get pregnant first and then deal with the entire disease later on. So that needs to be assessed on a very individual basis who needs what. But yes, in early disease, the role of laparoscopy is there, and it improves even spontaneous conception rates in these patients.
All right. And doctor, what's the rate of reoccurrence? When someone does go in for a surgery, when they know that they have the disorder, and they've done one session of laparoscopy. In your experience, what's the rate of reoccurrence? Because as you mentioned, this is something that doesn't really go away as such. So can you highlight on this, please?
Sure. So endometriosis is known to recur. We know that it's going to stay as long as your hormones stay.
Yes.
Because like I told you, the period cycle is the way the endometriosis functions. So as long as the hormones are present in the body, ovarian hormones are present under hormone influence, it is going to keep growing. So recurrence is very, very common. There are few ways to reduce the recurrence. So one is that sometimes your doctor, after your endometriosis surgery, might give you some hormonal medications which will suppress your ovary. So this could be in the form of pills, this could be in the form of hormonal devices that are put inside the uterus, like similar to copper teas, but hormonal devices. There are also newer tablets available now that we give patients post surgery for a long term basis, which will sort of reduce the rate of recurrence. In the sense, if the recurrence normally happens in 1 year, 1.5 year, then with this kind of treatment, recurrence might be pushed to 2 to 3 years. And this is especially useful in very young patients where you don't want them to undergo surgeries again and again, or then patients who are closer to menopause, where you know that what the ovarian function at some point is going to go away, and in the near future, so you can sort of tide that phase with medication. Having said that, in advanced endometriosis surgeries, sometimes we have to take the tough decision of taking out the ovaries itself, because ovaries are the reason where the hormones are being completely being generated from the ovaries, and that is what is basically building the disease and growing the disease. But that call has to be taken on a very, very individual basis with benefits versus risks, because ovarian removal at very early stage can impact your bone health, your cholesterol, your heart. So all of these things. So depending upon how severe it is, that call needs to be taken on an individual basis.
Yes.
And to prevent recurrent surgeries, the most important thing I would say is, in endometriosis, there is a dictum that your first surgery has to be the best surgery you undergo for endometriosis, which is why it needs to be done in the hands of an expert who is able to see the disease, understand the disease, and take out all the disease. Because a half-hearted surgery, there can be nothing worse than a half-hearted endometriosis surgery, because endometriosis itself causes clumping, adhesions of tissues, and surgery also is something that leads to adhesions. So if poorly done, then surgical adhesions along with endometriosis adhesions may actually push you into a more severe disease, and a more difficult surgery the second time.
Absolutely. Yes. Doctor, thank you for this plethora of information that you have given us today. I think This has been the most detailed conversation about endometriosis that we could have had, and that, all thanks to you, we have all this knowledge today. Um, Genuinely, thank you so much for this. And also, I think for all the young girls and, girls at their reproductive, stages in life who are listening to this, I think, from your side and from my side as well, I would like to say that, if you do find out that you have a condition like this, the sooner you go to an expert like Dr. Latika, the better it is going to be for the girl's personal health and her future as well. Because I think with everything, prevention is always better than cure. So, when you get hold of it at the beginning stages, I think, experts like you can get a hold of it and kind of intervene and change the scenario for the girls, instead of actually letting them suffer in pain and then, making very difficult choices in life later. So I think for all the girls who are listening, if you know that there is a condition like this that you have, like endometriosis, please consult and get in touch and get support from doctors like Dr. Latika, and try and help yourself. Lifestyle changes with the right kind of diet and with the right and the best kind of laparoscopic surgeries available at the moment. All thanks to the advanced technology that we have and expertise by you.
Thank you so much, Karishma. Actually, this is such an important topic. You won't believe, but worldwide, the delay in endometriosis surgery on an average is 10 years.
Yes.
Which means that from the time that it starts developing to the time that it is actually diagnosed is about a decade apart. And that is actually quite shameful, because we know that this disease from 1 to 10 years is going to change so dramatically. And if caught early, we are giving a better quality of life to our girls. We are giving better treatments to our girls. We are preventing fertility problems. So yes, I mean, it is very important to have an open eye for these things, especially if they're having chronic pelvic pain that is not going away, where everything else has been ruled out, or a little subfertility where, or your fertility doctor is telling you that everything looks normal. It might be a good idea to, understand endometriosis and think that, okay, maybe it's a good idea to put in a scope and check if we are dealing with early endometriosis. So all the girls and women out there should actually go and ask their gynecologist if they are suffering from something like this, so that they get diagnosed early and treated early.
Yes, absolutely. That's one of the reasons why, we are doing this awareness series, and we are doing these talks with experts like you, so that the girls get the right kind of information from the right people, and then they know to make better informed decisions about themselves and their hormonal health. Because I mean, with women, what else if not hormones? It's just we're all hormonal. That's what women are all about, So yes.
Already are dealing with a lot. I feel, and if we can put, we can make our life easy, we should do that. Yes, we should absolutely do that.
Thank you, Dr. Latika, once again for being a part of this conversation. I'm very happy that you could help us out with so much information today. Thank you so much.
Anytime, Karishma. Thank you so much for having me. Thanks.